I'm Dr. Kelly Paulson. I'm an immunotherapist here at Swedish Cancer Institute, and I'm a medical oncologist, which means I use medicines to fight cancer. Cancer is something that affects thousands of Americans every year. Most people that you know have had a loved one that's touched by cancer, whether it's a mother or a brother or a sister or a father. We know that we've made huge improvements in the way that we treat cancer over the last 10 to 20 years, but we also know that there's a long way to go. It's so frustrating when we see a patient and our current standard of care fails them. It's frustrating because we know that these treatments work for some and not for others. Often, we can't explain to people why it is that their treatment failed.
I started having pains in my abdomen probably a month and a half prior to being diagnosed. The ER doctor put me right into a PET scan. That's when he came with the diagnosis that it was non-Hodgkin's B-cell lymphoma. I think at that moment, I thought it was a death sentence.
At the Center for Immuno-oncology, I focus on immunotherapy because we use the immune system, which is really the body's natural way of fighting cancer. Stuart has a cancer that 10 years ago would have been terminal. The combination of chemoimmunotherapy put him into remission and gave him hope to be there to walk his daughter down the aisle, to see the birth of his grandchildren.
Now I'm almost to my 3rd anniversary of being cancer-free. The staff at Swedish was amazing. I think what I had 10 years prior would have been handled completely differently. There's been advances that made my chances much better. I'm glad those folks know what they're doing because they do a great job.
So the gift that founded the Paul G. Allen Research Center is truly transformative. It will greatly expand our ability to do life-changing clinical trials, both clinical trials to understand why what we're doing works and doesn't, and also clinical trials that bring the next generation of immune therapies to reach more patients. I'm excited about it. This gift is so powerful because improved immunotherapy treatments are not only helpful for people in general, but for the individuals that they touch. Each person saved from a previously untreatable cancer is a mother, a sister, a brother, a friend. We are giving people back their most important moments, and that change is meaningful, important, and real.